Good evening, friends. Pradeep Pendyala, your buddy, and today I am going to talk about Platinum 10 minutes. You must have heard about Golden Hour, and now the latest concept is Platinum 10 minutes. Very few people know exactly what it is and what is it all about. Today I am going to tell everything about it. There is perhaps something ghoulish. Ghoulish is nothing but something related to spirit, evil spirit, or ghosts. There is perhaps something ghoulish in the thought that immediately after the person's death, a whole tribe of surgeons may descend onto the person's body, ready to remove kidneys, heart, liver, lungs, pancreas, and any other bits and pieces, and that can hold off. This block is largely in our minds. Most people in good health would agree that their own organs would be better employed, donated after their death in helping to keep another person alive than in being burnt in a crematorium or buried in a coffin. It is, of course, not the role of medicine to confer immortality by continually replacing worn out parts. It is, however, the goal of medicine to preserve the health by minimizing the chances of fatality in case of trauma by providing immediate medical attention. The sound of ambulance itself reflects the cry of life. Would you agree? Life has become so mechanical that most of us have become immune to such sensitive issues. The focus of saving a life is weakened either due to fear arising out of the potential legal issues, legal problems if you save a person in an emergency, due to lack of people with knowledge and skill to offer the so-called pre-hospital care. Any tragedy can be taken to either success or failure within the first 10 minutes of medical attention. This crucial period is also referred to as part of the golden hour. Quick and the timely help rendered in this period would ensure that the victim is nearly saved so that appropriate treatment can be made available from the nearby hospital. Golden hour may be defined as the period during which all efforts are made to save a life before irreversible pathological changes can occur, thereby reducing or preventing death in the second and third phase. This period may range from the time of injury to definitive treatment in the hospital. The first platinum 10 minutes becomes important to make this golden hour effective and should be distributed accordingly to get fruitful results. Let me tell how it is distributed. In the first minute, assessment of the victim and primary survey. Next 5 minutes you should spend in resuscitation and stabilization. And next 4 minutes of the platinum 10 minutes should be spent in immobilization and transport to nearby hospital. That's how this golden 10 minutes are supposed to be spent. Now let me tell you something still interesting. That is, I'll tell something about related to my field, that is battlefield and military medicine. In battlefield medicine, ensuring the survival of wounded military personnel often comes down to stopping bleeding and initiating a blood transfusion as quickly as possible. And I'm sure you agree for that. But when dressing containing rapid clotting substances have been developed to control severe bleeding within seconds of their application and are used in conjunction with tourniquet, Bleeding remains a leading cause of death on the battlefield. I'm sure you would agree. Thus, instead of the golden hour, we would say the front lines of survival is to initiate care within few as early as within 10 minutes. The 10-minute interval, the Platinum 10, is a concept familiar to many rescue emergency providers and ambulance crews. And what do they do? Upon their arrival at the scene, assess the situation, initiate treatment, and transport the casualties. On the battlefield, the idea is very much the same and very similar to what the ambulance drivers go to and do, with the exception that the medical care and transport often is conducted within an active war zone or otherwise hostile environment. Thus, people who are trained in battlefield medicine must be prepared to provide care in every situation. In the battlefield, the majority of casualties die within 10 minutes of the trauma. Most injuries result from an explosion or hemorrhage plays a central vital role to improve survival. I would say the first 10 minutes is very, very important to provide medical support and in the first hour and control the damage. Damage control surgery has to be done. Now coming more and more about what is it all about. Early implementation of protocols has been reported to decrease patients' length of stay in the emergency department by making diagnostic test results available early, improving patients' time to critical care and bed availability. Through a hybrid format of virtual and physical presentation over 20 national, international experiments, many things have been found about the Platinum 10 minutes. An accident can happen anywhere, anytime, because the attendance time to an incident is an unknown quantity. For all practical purposes, it cannot be introduced as part of the equation. Therefore, the Platinum 10 is the first 10 minutes following the arrival of the key players at the rescue place and as a rescue team. Some may ask why we need such a philosophy. Why do we need such a philosophy of Platinum 10? When we measure the critical nature of a serious motor vehicle crash, we can arrive at a more definite logic which allows us to rationalize our performance in tune with the casualties' vital needs. The proportion of crashes that hold the critically injured will usually be recognized by the severity of the body deformity in the vehicle's structure. This can also be taken as a rule of thumb when assessing vehicle occupants. The mechanism of injury and a person's obvious injury patterns will alert the rescue team. On the other hand, the severity of the person's injuries may not always be apparent, particularly where they have been protected by an airbag. So we have to see the physically trapped and unconscious person is the most likely casualty to die in the minutes following a crash. On primary assessment, the doctor and the treating surgeon or physician should call for an immediate release, or where this is not possible, a rapid extrication of the casualty from the vehicle or the car. Of course, there is no value in calling for an immediate release or rapid extrication if no one knows what you are talking about or has never practiced. So what is required is a lot of practice and rehearsals of this kind of how do you manage and what do you do in this Platinum 10 minutes. Therefore, the Platinum 10 minutes must be realized and practiced for as the goal for casualty retrieval and setting up life support after arrival on scene. Whether it is done in vehicle or in the back of an ambulance should only be dictated by circumstances. If the casualty can be released, very well and good, but where the victim is pinned, this will not be an option. Where an immediate release is called for, we should appreciate that it can take several minutes to perform, during which time even basic life support may not prove possible. On the other hand, if the upright vehicle, in-vehicle resuscitation can invariably begin immediately and rapid extrication put into full swing. For the Platinum 10 to become a reality, we must have an intricate and interactive rescue team. We cannot hope to save a larger percentage of casualties without the intervention of a well-practiced, efficient rescue team who are well-versed in working together, like firefighters and paramedics work together. That's how they have to practice. How it can be made to work. A great frustration exists between many rescuers. So what is to be done? The training is required, practice protocols of medical and vehicle intervention and efficient and safe technical rescue to allow invasive care, treatment and patient monitoring, packaging and removal to be adequately and safely administered. That has to be practiced. Initial airway and cervical spine management, surgical airways to be taken care of, in-vehicle intubation to be practiced, in-vehicle oxygen therapy should be practiced, in-vehicle infusion and drug administration, in-vehicle thoracentesis, chest drain, in-vehicle monitoring, in-vehicle patient packaging. Such protocols have to be practiced. Risk recognition and control and reduction. These have to be practiced repeatedly and as many times as possible. Real life-saving initiative in rescue, there exists a feel-good factor where the motoring public holds the emergency services in high esteem. One has to imagine that TV and films and the influence of media coverage on real-life horrors has something to do with this. However, in real terms, it would be difficult to highlight the good in current rescue team performance and much easier to point the finger and show us the faults. So, the Platinum 10, along with suitable and efficient rapid extrication, will in future be seen as a real life-saving initiative. The influence is growing and rapid extrication should be adopted as far as possible. The Platinum 10 and rapid extrication is not a question of throwing caution to winds. Throwing caution to wind is not the question, or compromising the casualty's condition to speed their release, but rather an efficient drive, practice and well-versed in the extrication of the victim in line with critical care, administration and management has to be practiced repeatedly. I hope I have made the concept of Platinum 10 a bit easier for you. If you have not heard it or understood it, please listen to this video right from the beginning once again. You would understand every aspect of it. Thanks for patient listening. Until next time, goodbye. Take care. This is Colonel Pradeep Pindyala signing off for tonight. Bye-bye.